Now we will explain the cardiac output. Okay, cardiac work. Cardiac cardiac work. Okay, what is the cardiac work? Okay, cardiac work. That there you have a heart. Okay, and a heart have a the heart always doing work. So we have to find that how much work heart do, and what is the effect, and what work depend on the work, energy depend on the energy, depend on what things, depend on the pressure, depend on the blood volume. So all the things that is related to the cardiac work, we will explain it. Okay, so how you can identify cardiac work? Cardiac work is when one is the stroke volume. Stroke volume is actually the cardiac out. One is the stroke volume. We will tell about the stroke volume. We will about the cardiac output. All of things. So what is the cardiac output? First of all, we will explain cardiac output. Cardiac output is equal to stroke volume multiplied by heart rate. Mean the blood ejected by per heart rate multiplied by heart rate give you a cardiac output. That how much blood is move out from the heart. Okay, at 1 minute that is called cardiac output. Amount of volume of blood, how much volume is moving out, that is cardiac output at 1 minute. Okay, now we will explain one by one thing. The first thing, you have to represent pressure. This is pressure volume work. In pressure volume work, you have to just identify this is the pressure, this is the volume. Okay, so first of all, there is the when the isometric relaxation start. Okay, both of the wall, aortic wall and mitral tricuspid wall are closed. Okay, so isovolumetric relaxation start here, and at this area, the mitral wall open, mitral or tricuspid wall open. When they open, the blood move. After that, the reduced feeling is occur. Isovolumetric relaxation occur. After that, rapid feeling occur. Rapid feeling is occur after when the mitral valve is open. Now here, when the ventricle become full fill at this area, now the isovolumetric contraction occur. Both the aortic and pulmonary wall closes at the end diastolic pressure, and here is the end. At this area is called end diastolic pressure. Okay, both wall closes, mitral wall and aortic wall, and isovolumetric contraction started. At the end of isovolumetric contraction, the aortic or pulmonary wall open. When they open, the blood eject from the heart, from the ventricle, and that is called ejection. Okay, and here the mitral wall is, here the mitral or tricuspid wall is closed. Okay, and ejection is started. Okay, after all the blood is ejected from the ventricle, and when the blood is ejected from the ventricle, at here, that is called end systolic pressure. Okay, after the systolic, there is the end systolic pressure is identified here. So all the blood is ejected from here, and after that again isovolumetric relaxation here occur. At the end systolic pressure, both the atrial and mitral and tricuspid wall is both are closes. So at the end systolic pressure and end diastolic pressure, both wall are closes. And the end of isovolumetric contraction and isovolumetric relaxation. Isovolumetric contraction, the mitral wall is closes and the aortic wall is open. And isovolumetric relaxation, and the mitral wall is open and the aortic wall is closes. Okay, so you have to remember this thing. Now let's come here to the cardiac minute. Cardiac minute is actually the pressure multiplied by cardiac output. Cardiac minute work is actually the pressure multiplied by cardiac output. So you have to remember that what is cardiac output is equal to heart rate multiplied by stroke volume. Okay, these are the two things. Now you have to multiply this. After that, you can also identify cardiac minute work is equal to pressure multiplied by cardiac output. Okay, so pressure is cardiac output is equal to heart rate multiplied by stroke volume. We have write this. Now after did just write stroke volume multiplied by pressure, stroke volume multiplied by pressure, and heart rate alone. Okay, now this is called stroke work. Pressure, if you see, pressure multiplied by volume is equal to work. Okay, so here is the pressure and work, so it is called stroke volume. and there is called the heart rate. So cardiac minute output is equal to stroke work multiplied by heart rate. Okay, this is about the cardiac minute volume. So cardiac minute volume equation become stroke work multiplied by heart rate, and stroke work is equal to pressure pressure multiplied by stroke volume. Okay, now there is one is the pressure work, one is the volume work. You have to identify the difference. The pressure work is actually physiologically, for example, aortic pressure. There is the aorta, and aorta have a pressure, and against that pressure, for example, there is this is a tube. Okay, there is also a pressure present, and if you want to add more something, you have to increase the pressure here. Against this pressure, you move the blood against this pressure, against this pressure. This is called pressure work. Okay, if someone, for example, this is a wall, this is something, and there are many person, they are pushing this wall, so they create a pressure. Okay, and if you want to move this against them, against this pressure, so that is called pressure work. Okay, now the second thing is volume work. For example, if there is a water, and if in the one pot, okay, in one pot, and you want to put it into another pot, you just for you open you open you all of the blood, all of the fluid insert into this. Okay, fill this pot, this hot pot, etc. So this is called volume work. You give volume to something. For example, this is the artery. Okay, and from this volume, you give this volume of blood to here. This is called volume work. Okay, you transfer volume from this area to this is called volume work. How much volume, this is called volume, and against how much pressure, that is called pressure work. So mostly the energy is used actually due to pressure, against the pressure. So the pressure work is more important, and pressure work use more energy. Okay, the pressure work more use energy. You have to know this answer. So one is the pressure work, another is volume work. Pressure work is physiologically aortic pressure, and pathologically how the pressure is increases if there is aortic stenosis. For example, this is the wall. Okay, and you want to move the blood against this pressure, and if this area is become narrow, so you have to create more and more pressure to move the blood through this area. So this is pathological if the aortic stenosis is present. And another is, this is the aorta pressure, and this is the ventricle pressure. So this pressure is actually physiological pressure. Okay, but if the wall become narrow, so the more pressure, you need more pressure, and that more pressure is actually due to pathological condition. Okay, due to aortic stenosis. So one is the cardiac minute work is directly related to the. Now let's come here. Another is volume work, amount of the blood. So cardiac output is equal to stroke volume multiplied by heart rate. So volume work is related with the cardiac output. Now cardiac minute work is directly related with the myocardial oxygen consumption. Okay, because myocardium use oxygen, so the tissue that do more work, they use more oxygen. So if the cardiac minute work is more, they use more oxygen. And another thing is, you have to remember that pressure work is more and more than the volume work. This is volume work and this is pressure work. So you can see pressure work is more, so they use more energy. Myocardial oxygen consumption is more in the pressure work. Okay, so if there is aortic stenosis, the pressure work becomes so much increased, volume work is decreased. But if the pressure work is decreased, so myocardial oxygen consumption also increase. More oxygen is needed. If the oxygen requirement is not completed, that part will become ischemic. Okay, now you come here, left ventricle and right atrium. They both of them extract same volume. Okay, so the volume work is same. Now come here, there is the aorta in the left. From the left ventricle, blood goes toward the aorta, and from right ventricle goes toward the pulmonary trunk. Okay, so aortic pressure are 100 millimeter of Hg, and pulmonary pressure is 15 millimeter Hg. So the 100 millimeter Hg pressure is so much large. Okay, So left ventricle do more pressure work, they do more pressure work. Ventricle, so that's why its ventricle is thick wall, that its ventricle wall is thick, that's why, because it have used more oxygen. Ventricle wall is thick, so it use more oxygen. And the right ventricle push against the 15 millimeter edge, so less pressure work, and the ventricle wall is thin and less oxygen is needed for it. Now come to the pathological condition. Pathological condition in the pathological condition in the minute one. For example, if the systemic hypertension, if your body have hypertension, if systemic hypertension, so aortic pressure is so high, aortic pressure become so much high. If the aortic pressure is so much high, what will happen? The things that happen, that is called the if the aortic pressure is so much high, what will happen? That is called the stroke. Systemic vascular resistance is so much increased. What? In pathological, is if the aortic pressure is so much high, it means the systemic resistance, systemic vascular resistance, or total peripheral resistance is increases. So now the left ventricle need more work, more pressure work, so there will be hypertrophy occur in the left ventricle. So actually it is ventricular hypertrophy. Now if the pulmonary hypertension is occur in some patient, okay, the pulmonary pressure is increases, right ventricle become hypertrophy to become large, become hypertrophic. For example, bodybuilder use can do more work, so if this become hypertrophic, so they can move the blood against the high pressure, okay. So at both of them are ventricular hypertrophy, and they use myocardial oxygen consumption become increased. So if the hypertrophy occur, if hypertrophy occur, if hypertrophy occur, their myocardial oxygen consumption become more and more. Okay, so you have to just remember this hypertrophy. When there is hypertrophy, there will be myocardial oxygen consumption is more. Okay, and sometimes it is maybe physiological. How, for example, in the athletes, etc., the hypertrophy is actually physiological. Okay, we will explain it. So this is about the, we will explain the cardiac output, etc. Okay, so thanks for watching, like the video and subscribe the channel. Thanks for watching.